Hello, my name's Claire Howard and I'm the chair of the Polypharmacy Prescribing Comparator Working Group. We are a group of GPs, pharmacists and business analysts from the Business Services Authority, and we've been working together for about 4 or 5 years to create the Polypharmacy Prescribing Comparators. The comparators were originally designed to help you look at variation in polypharmacy prescribing, help you to identify which areas of polypharmacy prescribing were your priorities and areas that you might need to focus on, and help you to identify the patients who appear within these comparators in order that you could then bring them in for a structured medication review. And ultimately, we wanted to save you having to develop your own local system searches. So through the ability with the BSA, you can identify those patients, have their NHS numbers and work through those patients as a group, calling them in for their medication review. The polypharmacy prescribing comparators are made up of volume comparators that demonstrate how many patients you've got on 8 or more, 10 or more, 15 or more, or 20 or more medicines. And you can also look at the different age groups that constitute those groups. There are also therapeutic comparators. In 2017, we launched the first versions of the therapeutic comparators, but over the last 12 months, we've been working to add some new comparators. We've reorganised the anticholinergic burden comparator for you, and we've added 3 new comparators. So you'll be able to see patients concurrently prescribed multiple analgesic medicines, patients prescribed SSRI or SNRIs and medicines known to increase the risk of bleeding, and patients prescribed 2, 3 or 4 or more medicines that can have an unwanted hypotensive effect. We hope that through those additional comparators, you're able to identify extra patients who may be at risk from problematic polypharmacy. So I'm now going to hand over to Paul, who will demonstrate the comparators and how they work and how you can make best use of them by identifying those patients that you can bring in for a structured medication review.
The Polypharmacy Prescribing Comparators dashboard is a fantastic tool available in EPAC 2. To access the dashboard, from the EPAC 2 landing page, just select Dashboards. All of the EPAC 2 dashboards will be displayed, but to access the Polypharmacy dashboard, just give it a click. The dashboard is split by organisation level, with each level having its own section. It contains a CCG view, a PCN view, right down to practice views. Each of the pages has been designed to allow you to benchmark your organisation, prioritise where you could make interventions, and measure the impact of those interventions. As Claire mentioned, the dashboard also includes information on how to request patient NHS numbers for those of you with direct clinical care. We cover this later in the video. In this example, I've selected the volume comparator, percentage of patients prescribed 10 or more unique medicines. It's really simple to select another of the many useful polypharmacy comparators. To do so, I can just click the arrow at the end of this list, and all of the comparators will be displayed. The newer therapeutic comparators are listed here too. For example, here is the percentage of patients prescribed an SSRI or an SNRI concurrently with 2 other medicines comparator. I can select it, press apply, and the page will update to show me the data for this comparator. Every page, whatever the comparator you pick, contains a bar chart, which shows how your selected organisation compares to others to support you to benchmark, and a line chart, which is to allow you to track and measure change over time for your organisation. A useful feature of the dashboard is the ability to turn the chart views into data views. To do so, you can click the display option located just above the chart. If you select data, the page will update to show you a table of data. This is especially useful as it allows you to see the exact number of patients that will fall within that comparator for the selected organisation and month. This information is in the numerator column. Definitions for what the numerator and denominator columns are showing you can be found by moving your mouse over the links above. So far we've been looking at the comparators across all age bands. However, the dashboards contain the ability to view specific age bands. In earlier versions of the dashboard, you had the ability to select from age bands in the over 65s, over 75s and over 85s category. The working group created the new functionality around the age bands because polypharmacy, whilst a particular challenge for older patients, is not exclusive to the over 65s. We know that in more deprived areas, polypharmacy is an issue for much younger groups. This new functionality puts you, the user, in control of how you cut the data. When looking at the CCG level, you can also compare yourself to organisations with similar demographics, using the similar 10 structure, which has its own page. This is to give you a more accurate idea of the areas of prescribing that may be a priority problem for you. Whatever the page, it's worth noting that you always have the option to select different months or different organisations. Once you've picked them, you can then just press apply. Finally, we mentioned that you have the option to request the patient NHS numbers of the patients that you've identified using the dashboard. Details on this process can be found in the supporting information section on the patient details page. We rightly have a clear and strict process to ensure only those with direct clinical care of the patients can access the NHS numbers. But we encourage all of you that do to use this process. And as Claire said earlier, save time by letting us get the NHS numbers to you rather than you doing your own local searches on your clinical systems. Thanks for watching, and I hope you can see how you can use the Polypharmacy Prescribing Comparators dashboard in your work to improve patient outcomes.